Hello, good afternoon. I just wanted to come on here because I decided, we as a group decided I'm going to do the live introduction. So, how I want to start this is the nursing informatics. That started, the first internet based nursing informatics, it started at, at Duck University, and it started in 1997. And back then, 1997, let me just sit down, sorry. So in 1997, it first started. So, of course, anything new, you're going to have some bumps and humps to come over on, and nothing's going to go smoothly. And they did. They had a lot of issues when nursing informatics started initially, okay, over at Duck University in 1997. And I'm talking, they had like internet speed problems, hardware problems, software problems, just problem after problems. Okay. So, nevertheless, besides that, with all that going on, the technology was just steady evolving quickly. And I guess that they probably wondered, like, wait a minute, it's going so fast. We got to get our nurses up to par. So they then began to put a education arrangement into play for the nurses. And this was to improve nursing care and the quality of patient care. So with putting that in play, they had competencies that they had to meet, and this was determined by three categories, and the categories were it was computer skills, informatic knowledge, and informatic skills. Okay, so with that, it investigated four levels of nursing. And the four levels of nursing was the beginning nurse, the experienced nurse, the informatics specialist, and the informatics innovator. Okay, so let's back up. So again, like I said earlier, they had the computer skills, they had the informatics knowledge. Okay, this is the four. Remember that the categories that they had to meet with the competencies. So the computer skills, the informatic knowledge, the computer. I'm sorry. Let me start. It was the computer skills, the informatic knowledge, and the informatic skills. Okay. So with computer skills, you had the retrieving patient demographic data. You had the electronic devices. You had the use of information technology. Okay, this is all of the pieces of this system that the nurses had to learn. Computer technology safety, because again, we just don't want to put someone's information out there for anybody to use, and we went into that a little bit a while ago in reference to the certification EHRs. So that was the computer skill aspect. Then you go to the information knowledge. So they had to know this base, and that was recognition of the use or the importance of improving practice, improving data, collecting data, and improving data practice, and recognition of fact that the computer can only facilitate nursing care. Okay. Also, we have to realize that you know uh, human functions cannot be performed by the computer. So even though the computer informatics, I mean, it's a lot the computer can do, but just we know that the computers can't do everything. If they did, we would be out of a job. So that was that. And I'm sorry, it's in my way. And then the other aspect was informatics skills. So with informatics skills, it was the interpretation of information, the flow within the organization, the preparation process of information, the flow charts with the flow charts for all aspects of the clinical systems, the development of standards, and the database structure. They had to learn that. Education, they had to know the administration of the computer system and the research aspect of it. So that's a little introduction on nursing informatics as a specialty. And again, like I said in the beginning, this, even though they had a lot of kinks that they had to work out in the beginning, this technology was steady evolving at a fast rate. So again, educating the nurses into this technology and information, and getting putting education, getting, I think it's like the bachelor, you got to have the bachelor's. So all that comes into play. And again, the bottom line is good nursing care and good quality care for the patients, and safe. Keep the patient safe, and also keeping their information safe. Because again, this is computers. So we gotta work hard to keep the information safe and private. So that is my conclusion with the introduction to informatics as a specialty. I apologize, I'm kind of like in uniform, but so that's my conclusion. And I hope this kind of clears up, because I didn't want you to do all the reading. So I hope this clears up a little bit. All right. And thank you. And please give me feedback, because I want to apologize. I do, this patent is new to me, and I had to research it out before I even started it. So I apologize. So I'm trying to get things in order and get acclimated to it before our final presentation. So have a nice day. Bye-bye.